In rural communities, emergency access to care can be scarce. In a trauma situation, the first 30 minutes are the most important. And now we're learning how Texas is trying to overcome distance with technology.
KCBD News Channel 11 Sydney Lowther joins us in studio with how telehealth may be the answer to faster response time. Sydney?
Christy, in case that first 30 minutes can be the difference between life and death in a trauma situation. In towns like Plainview, Dimmitt, and Muleshoe, it can take more than an hour to get to the nearest level 1 trauma center. That means those crucial minutes are typically spent on the road.
We're shortening the length of time from the need to the care.
Many healthcare workers, like Billy Phillips at the Texas Tech Health Sciences Center, refer to the first hour after a traumatic injury as the golden hour.
The quicker we can get people at the time of their trauma, begin their planning and the execution of treatment, the better the outcomes will be.
UMC in Lubbock is the only level 1 trauma center between Dallas and Albuquerque. That leaves many communities outside the city to depend on their own resources. That is what Phillips specializes in as the Vice President and Director of Rural and Community Health at the HSC.
We needed a solution that would allow the people who run the trauma centers to actually visualize the trauma.
A new law effective on September 1st will do just that. It creates a pilot program aimed at providing emergency telemedicine medical services and telehealth services before and during the trip to a hospital.
Allow the emergency department staff to observe the patient where it occurred as they transport and guide that. Then a lot of things can be started so that when you come in, it doesn't need to be duplicated.
The trick is guaranteeing internet access in the back of an ambulance in rural areas of West Texas, where service may be spotty.
We found a solution to that, a particular kind of software that constantly searches for the strongest signal wherever it is.
The EMS units will be equipped with the technology and the crews will be trained so life-saving measures can be taken during the ride to the hospital.
A lot of the things that people need immediately can be taken care of very efficiently with just that encounter.
Once they're installed, each of these telemedicine units will connect directly to the Texas Tech Health Sciences Center. It is the only provider involved in this pilot project. The program will last for 5 years. Then the HSC will report its findings to the legislature for further expansion. Case and Christie.